What are the best screening protocols for high-risk HPV types? Imagine catching a potential health issue early before it becomes serious. That's exactly what screening for high-risk human papillomavirus, or HPV, aims to do. These types of HPV are strongly linked to cervical cancer and some other reproductive cancers. The best way to detect these high-risk types involves specific testing strategies recommended by top health authorities. For people aged 25 to 65, the primary screening method is HPV testing every 5 years. This test looks for the DNA or mRNA of high-risk HPV types, especially those that can cause cellular changes leading to cancer. Detecting the virus early allows for closer monitoring or further testing if needed. This approach is preferred because it's more sensitive than traditional Pap tests alone and helps catch problems before abnormal cells develop. If primary HPV testing isn't available, co-testing is an alternative. This combines HPV testing with a Pap smear every 5 years. The Pap test examines cervical cells for abnormalities, while HPV testing checks for the virus itself. Both together provide a comprehensive picture of cervical health. Another option is cytology testing alone, which involves a Pap smear every 3 years. While still useful, it's less sensitive than HPV-based tests and might miss some infections. The decision on which method to use depends on individual risk factors and healthcare provider recommendations. Screening usually begins at age 25 or 30, depending on local guidelines, and continues until age 65 if previous tests have been negative and there are no high-risk factors. Screening isn't recommended for those under 21 or over 65 who have had consistent negative results and no new risk factors. Why is HPV testing so effective? Because it detects the virus before cellular changes happen, giving a longer window for prevention. The high negative predictive value of HPV tests means that if the result is negative, the chance of developing cervical cancer soon is very low. This allows for longer intervals between screenings, reducing unnecessary procedures and anxiety. It's important to note that HPV testing is also relevant for other cancers, like some head and neck cancers, where high-risk HPV presence can influence diagnosis and treatment. Even vaccinated individuals should follow screening guidelines because vaccines do not cover all high-risk HPV types. Emerging options like self-collected samples are making screening more accessible, especially for those who face barriers to clinic visits. For immunocompromised people, such as those living with HIV, more frequent screening might be necessary. Currently, there are no standard screening tests for HPV-related testicular or other reproductive cancers, but HPV testing remains vital for cancers of the cervix, vulva, vagina, anus, penis, and oropharynx. In summary, the most effective current protocol for high-risk HPV types is primary HPV testing every 5 years for those aged 25 to 65. Alternatives include co-testing or cytology testing at shorter intervals, depending on individual circumstances. These guidelines are based on extensive research and consensus from leading health organizations, aiming to detect potential issues early while minimizing unnecessary procedures. Always consult your healthcare provider to determine the best screening plan tailored to your health history and risk factors.